the cardiovascular, that strengthening the muscles is extremely important. So this recommendation, you should also be taking into account at least 2 days of strengthening. So you want to exercise about 6 of the major body parts 2 days a week to get your muscles stronger, because then that also burns fat, but it also keeps your metabolism high. So that should be incorporated into the exercise. So there's a big assumption that it's all just, aerobic and walking and doing those kind of exercises. But it's really important that we do some strengthening, and we'll give you some examples of those in a little bit.
So what is the best exercise? It's the one that you actually will do, right? We all don't like exercising, but if you find something that you will do, if you love walking, then that is the best exercise for you. We know some people are runners, right? That's the best. But whatever is something that you can do, a routine that you can get involved in, and it's good to have a buddy. It's good to have a care partner that will do that with you, or So that's really the key: is find something that you like and something that you will do. So this is just a little bit about the research, right? That regular exercise can reduce the developing of dementia about 28%. For Alzheimer's disease specifically, the risk is reduced by 45%. So these numbers come from an analysis that combined a result of 16 different studies. So really important that they are finding that exercise can help. It really helps promote the neuroplasticity of the brain. That's the ability of the brain to adapt and reorganize, which can help preserve cognitive function. So statistics and studies are showing that exercise can slow the progression of dementia.
And it's a lot easier to get somebody involved if you start in the early stages. So if you've already gotten into a second stage and you're introducing exercises that they've never done before, it's going to be that much harder for people to follow the routines and understand what you're doing with them. So it's best to start, if they haven't been an exerciser all their life, it's best to start as soon as possible after a diagnosis.
Right, because remember when we talk a little bit about dementia, it's really about that long-term memory that people have. So if you can kind of get that instilled in them early on, then it will become part of their regular routine as the disease progresses a little bit.
This was the statistic that Gigi was talking about. I found this astounding and amazing, and a reason to exercise. As soon as I saw this, I jumped downstairs on my Peloton and I did about 30 minutes. My husband said, "Hallelujah, you're using it." Yeah. But this is just very encouraging.
Yep. So how can the caregiver help someone with dementia stay active? So we'll talk a little bit about choosing the right activities at the right stage. You want to talk a little bit about that?
So in order to, I don't want you to think of exercise as just exercise. You can also think as exercise as activities, because some people are never going to want to do road exercises, and they don't have to. There are other ways to get the same thing done by using activities, but you have to understand what stage the person is in to properly match up an exercise or an activity. You want to identify the problem areas that stage is associated with, so that then you can use the remaining capacities to figure out what's going to be best suited for this person. And really important is you want to set up a just right match. So a just right match means if you're setting things up to be too difficult, you're going to discourage that person. That person is not going to feel motivated. But if you set something up where they can be successful at an activity and you've graded it properly, you're going to see much more of a desire for that person to engage. So when we talk about stage one, we're talking about, and I'll just say something about this. There's 7 stages of dementia that are often talked about clinically. I find that a little overwhelming for the general public. So there's also a staging system that has 4 stages. So I'm going to use that for this presentation. So stage 1 is going to be your mild to very mild to mild cognitive decline. So some of us actually sitting here are probably already in this state. I am probably already in this state. So you're feeling a little bit of memory loss. You're feeling a little bit of loss of control over your memory and over some things in your life. You just know that something's going on, something's changing, right? You become upset when you're confronted. So if you find that your loved one is becoming agitated when you point out that they've lost their keys or their wallet or they've forgotten something or misplaced something, that is very, very common. The person goes into a defense mode. So oftentimes that's one of the diagnosing features of dementia. If somebody tries to what we call mask. So masking is pretending that, oh no, I didn't lose my keys. I put them where they're supposed to go. I was distracted and then, you moved them. That kind of talk is called masking and trying to make excuses for the mild memory problems that somebody's having in stage one. There's less initiation. That's important because it means you're going to have to work that much harder to get somebody into doing something like exercise. They're not going to want to initiate things on their own. Um, Towards the mild, you're going to see more word finding issues, more difficulty with attention and with comprehension. And you're also going to see mild problems with praxis. So praxis is that ability to coordinate the body. Okay. So those are all starting by the end of stage one. So what you want to do in stage one, when you've probably just began to realize that something's going on, the person might not yet have a diagnosis, is you want to start encouraging physical exercise and wellness behavior right at the start. Establish a routine that includes exercise. So every day, maybe there's a good time of day right before lunch where you think, you know what, this might be a good time to get mom up or my husband up to do a few exercises, and it can become part of the lunch routine. He does the exercises, I make a little lunch, then we sit together after lunch. So that becomes ingrained, and that person starts to recognize that before lunch, they're going to do some physical activity. Um, Putting exercise and activities on a calendar or in a simple planner so that it's written down and making that person accountable for it as well and saying, look, today is the day we're doing some strengthening. Today is our strengthening day. Or today is our cardio day, or today we're going to do some gardening, okay? Or we're going to do some house cleaning, which by the way counts as exercise, right? At this stage, you do want to start using, auditory, so verbal cueing, but you also want to start including visuals and kinesthetic input. So what that means is people are going to start to work better off of pictures than they're going to work off of your words. So demonstrating for somebody or showing pictorials is going to work better than just saying, Mom, do 10 bicep curls. Okay. You're going to rather show them what you want them to do. And you might have to continue the exercise with them because they may stop. Okay. And also with that decreased initiation, by demoing it, they're more likely to look at what you're doing and join along. So that's what we mean by that kinesthetic input. Determine if music's helpful at this point. So in later stages of dementia, music is fantastic. At this point where somebody's just starting to have concentrational, attentional issues, music might actually be distracting. So I ran a class the other day at one of the assisted livings, and we've chosen not to do it with music. And that was the choice of the people that came to the class who were, this stage one, late stage one. And they found that it would distract them from what they were trying to imitate or what they were trying to achieve in that class. So we don't use music. But then in later stages of dementia, it's fantastic because the words are not being absorbed. They're not concentrating on your words. They're concentrating more on the sensory input you're giving them, which could include music. Sorry, go
I
ahead.
just want to interrupt one thing. So in this stage, this is really important to develop the habit, right? So it takes a good 2 weeks for anything to become like part of your routine. So, in so like what I was talking about, make that routine either before lunch or right after lunch, and then it becomes part of their, the person's daily activity.
And definitely provide positive feedback. So not just for each exercise, but just for somebody partaking in exercise, because this diagnosis can be very discouraging to people. So it's really important to say, this was great that you did this, and the person's going to feel better. So it's gonna fight that urge to kind of slip into a depressive state and think that, you're trajectory is going this way. It's going to make you feel good and realize that you still, people still have things to offer, and life to live at this stage, 100%. An example of an activity versus an exercise, gardening is a great one and can be adapted. So many people say,
if you like gardening.
right, if you don't like gardening, don't just start jumping into it.
Yeah, people who love, they get, gardening and weeding, like they do, that's just part of them, but.
But you're using almost every body part in traditional gardening. If you need to adapt things, there's things like higher garden boxes that you'll see now. They're selling them everywhere. I just saw some, I think, at Costco, like the raised garden beds that are about this height so that people don't have to bend. Because most people that stop gardening, they talk about their hands and they talk about their knees and having trouble getting down. If you have a raised bed, that problem's eliminated. What I like about gardening is it also can be graded for later stages. So if somebody's in a later stage, and you say, well, how can they go outside and garden? They can't, they don't have that capability anymore. Well, why not set them up at a table and set up, something like planting seeds in a potter? It doesn't have to be the all-out activity that you're accustomed to. We can grade these things so that somebody who has a love for it can keep going throughout their life. If you took gardening away from me at any stage, I would be miserable. So right until the last stage, I want to be gardening in some way, shape, or form, whether that means just watering plants. And I see people take watering plants very seriously, and I've incorporated that into a lot of therapy, and it's wonderful to have people, prune plants, water plants. If people are still in the early stages and they can rake, that's a wonderful activity. It's cardiovascular, it's also strengthening. And if people can still do things like pruning and weeding, that is all these muscles. When you come down like this, you're using all of these muscles, okay? Dancing is another great exercise. You could do this, just two people, or you could do a group session for dancing. It could involve, ribbons, balloons, balls to make it more, again, we're grading to level. So making it more fun. Some people will say somewhat childish, but I think that dancing is something that everybody naturally gets happy doing. And if you can add silly things to it, why not? So we'll do that a little bit later on. What's good about it is it can also be done in a seated position. I've danced with people that are in wheelchairs. It's fantastic and it's fun. It increases strength and flexibility. It helps staying steady and agile, and it reduces stress. So this is an example where you would use music. So then you're moving into stage 2, which is mild to moderate decline. So this is where you're really going to have to start looking at grading activities, and really your number one concern should be making sure that person is safe. So some of the exercises that we describe in this stage, you may have to be guarding or standing right by that person, or you might have to downgrade some of the exercises depending on their capabilities. But here are some common symptoms at this stage. Anxious or hostile behavior. So you hear about people with dementia becoming agitated. A lot of times that is because they want to move or because they can't make their needs known. So if you see somebody that's getting anxious or hostile, one of the best things to do is get them up and moving. Something that I hate to see is when caregivers or family members say, no, 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 sit down, mom, when the person's trying to get up. The person's trying to get up because they've got some energy that they need to work out, or maybe they need to go to the bathroom. So maybe walking them to the bathroom, but get that person up and try to figure out what they need. And it could just mean that they need to be moving. They may use denial. They'll withdraw when things are challenging. So that's what's important about that just right challenge. If you give them an activity that's too hard, they're going to back away from it. They're going to be discouraged. At this stage, we also see some paranoia. So you've got the most common one that I see in many of the facilities and homes is mom thinks that somebody has taken her wallet. Okay, I can't find my wallet. I can't find my wallet. Somebody took my wallet. And a lot of caregivers will go, no, mom, your wallet is right there. I keep telling you this. Don't you remember? Well, no, they don't remember. Okay. And you're using a logic that they can't understand. So how do you address somebody that has this issue? Okay. Mom loses her wallet. I'm the daughter. I would say, Mom, I'm so sorry. That's terrible that somebody took your wallet. Why don't we go for a walk and look for it? Let's go look in the other room. Get to the other room. Mom has now forgotten about the wallet, and you point at a picture and say, Mom, who is that in this picture? And you redirect. Okay. So very good for paranoia, delusions, hallucination, to redirect somebody, but also to let them know that you hear them and that you're not denying what they're saying. You're stepping into their world and saying, I understand and I'm sorry. Moderate memory loss at this stage for sure. Lots of things being misplaced, like we just said, the keys and the wallet. And the wallet's a big one because financial security for people, right? It's symbolic of financial security. So that's why a lot of times people will be clinging onto their purse. That's very common. Or looking for a wallet or looking for their keys, because keys are related to what? Driving or their car and their independence. So those are why those become the fixations. Decreased problem solving skills. So you're going to have to jump in and help with things like bill pay, difficulty learning new skills. So this is why we're saying teach exercise routines early on. So now it's ingrained in their body. Oh yeah, we're doing the squats. Next comes the kicks. You know, it becomes an automatic response rather than them having to rely on memorization. Their visual spatial deficits worsen. So this is where you see a lot of falls happening because people are not seeing curbs. They're not seeing transitions from rug to floor. So this is where safety becomes very important. The need for supervision increases and socialization decreases. So trying to get somebody to go to group exercise is really important, but there might be times where it's more appropriate, where the stimulus is too much for somebody, that you want to keep it to a small group, or you want to do something at home on those days. Moderate IADL problems. So IADLs are things like housekeep. Oh, I'm sorry. Does somebody have a question?
Well, I said when you were talking about losing things like keys and I'm sure you're familiar with the Tile app.
Yes, that's fabulous.
Yeah.
So the Tile app is something I think Apple created it, and you attach it to things so that if it's lost, it's like a GPS tracker essentially. And we will talk about other kinds of trackers as well a little bit later with the technology that you can use for safe exercising, but that's a great point. So IADLs is things like cleaning your house, making a bed, cooking meals. So those things, now that person is really not able to do those without somebody assisting them. And their ADLs, which are our basic skills like dressing, bathing, grooming, we're starting to see problems where, again, a helper has to jump in and help with those things. The worst thing that you could do at this stage is take over those things completely and leave the person out, because they're going to learn learned helplessness, which means that you start to put somebody's pants on for them. Why are they going to do it anymore? You see what I'm saying? So if you're making a bed, Mom, come on, Mom, help me make the bed. You know, you do it together so that that person is getting the benefit of feeling involved and feeling like she can still do stuff. Hobbies that are difficult are going to be dropped at this phase. So you want to be creative and say, like the gardening, well, Mom can't do this anymore, but you know what? Maybe if I just make the task more like this might work for her. So this is where you want to start grading things to make it a little bit easier so that the person doesn't need to completely give it up. So you're going to simplify complex tasks and break it down. So the way that I'm talking, I would be talking half this speed if I was working with somebody in this stage. So I might have to give a cue and say, stand up, Mom, and let's do our exercises. And I might have to wait. The rule is wait 90 seconds for a response. It seems like a really long time. I've had clients where I've thought, person did not register that command, and literally in a minute or 90 seconds later, the person rises to follow my command. It takes that long for some people at this stage to process information, okay? You want to maintain socializations, but at a smaller level. And if you have somebody at this stage in a group setting, just know that they're not going to be the initiator. So if you all talk amongst yourself and you ignore that person, they're going to be left out. What you want to do, and there's a fear of talking to people with dementia, right? We have to get over that fear. We have to look at that person. They're still the same person they were before. How are you doing today? Do you want to join us for a game of cards? You talk as if they're anybody else. Okay. You might have to slow down. You might have to change a few words you use, but ignoring the person is the worst thing you can do for their self-esteem. Again, I'll say it again. This person still has meaning and has a reason for being here with us. Okay. And we want to treat that person that way throughout all of the stages. Encourage stretching, walking, and balance activities, because at this stage, those become issues. Balance becomes a big issue. And you might have to consider outside resources because you may, as a caregiver, need some respite as well. So bringing somebody to an exercise class or to an outpatient could be time for you to go grab lunch with a friend or just have a break, because this is a tough job, right? Caregiving for somebody in this stage is a tough job. So what kind of exercise series can you do? They're much simpler than you think. They don't take a lot of time, and we'll show you some basic ones that that you can do in the series, and we'll give you handouts so that you can do them with your loved one.
Right. So these are just some general kind of standing exercises that can help with balance. They help with strength. They help with lower extremity coordination, and they're just kind of just basic exercises. So we do
I'm
it.
so sorry, but you're gonna have to.
We're all gonna participate. Okay.
If you have any issues where you don't want to participate, it's totally fine. We're not forcing, but we want to give you a sense of what it feels like. So these are chair exercises. So your hands are going to go on the back of the chair for balance and safety. Okay.
So basically, yeah, just and hold on. That old song, "Hold On Loosely." Like, hold on loosely. Don't grab that unless you really have to. But you want to work on your balance, and you can use these on chairs. Countertops are great, right? Kitchen counters are really good. Dining room table, something sturdy to do. So basically, you're kind of holding on loosely, standing up nice and tall. This is all about posture. Posture is so important when anytime we're doing exercise. And you're just standing up tall, and you're just kind of bringing your legs straight back. So what it does is when you're on one foot, it helps with your balance. Anytime when we're walking, right? We're walking on one foot. So hold on loosely and just bringing your foot straight back, and you're focusing nice and slow. So you're just repeating 10 times, and you're thinking about kind of like your butt muscle, and again, you're working on your balance. We don't want to be going back and forth really fast. This is just using momentum. It's not using your strength. So, and then you do about 10 of those on that side, and you go back, and now you're standing on the other leg, and you're going straight back and doing 10 on the other side.
So if somebody has a hard time doing this, you can cut those sets down.
Yes.
You can do 5.
Right. And if it's easy for you, do it with one hand, right? You're standing just using one hand for balance, right? You can do it. Any of these you can kind of do like that. Hold with one finger, so you can kind of judge it. But again, trying to get into that rhythm and that routine is really, really important. Next one, same position, and you're kind of kicking yourself in the butt, right? Taking your leg, again, focusing on standing on the one leg, up nice and tall. We don't want to be slouched over, nice and slow. Try to just kick yourself right in the butt. And then just switching and doing the other side. Okay, so bringing it straight down, up. Night exercise should be slow, and I'm going to give you copies of these.
Oh, okay.
Yeah.
Yeah.
Yep. So slow and in control, right? That's how we do it. So start with 5, work your way up to 10. You can do 2 sets of 10, work yourself to 20. Whatever you can do. Judging with one hand, 2 hands, that kind of thing. Same idea, up tall, out to the side, right? So again, we're working on stabilizing on one side, balance. Working, we don't realize that this hip abductor, we call it, like, walking side to side. We don't really work that one very much. So it's good to,
So I think of this one when I
Yeah.
have people step into a shower, right?
Yeah.
They have to sidestep to get in. And if you're stepping over a tub, you have to actually incorporate that kick back and the bend of the leg to come over the tub. So all of these tie into keeping you able to do some of those basic transfers that you're going to need to do.
and again, good posture, good breathing all throughout these. This next one is really just working on the ankle and the calf, heel raises and toe raises. You can kind of go back and forth. You're kind of rocking on, the heel to the toe. Okay.
At home, some people prefer to do this in front of the sink so that they can grasp down like this.
Yes.
Some people are not okay just using a counter, so in that case, a sink might give them more security.
Yep. And, one hand, two hand, you can actually do one-handed or one leg, heel to toe. If that's, if it's a little more challenging for you, you can do that. Really good to have that ankle strength and control. Next one, really good for the lower body, is the squat, right? So we call it a mini squat. You're not bending forward with your nose. You're almost like you're squatting down like you're going to sit in a chair, right? You're squatting. You don't go all the way down, and you hold it there, and then you just come up nice and tall, right? So we're sticking our butts out when we do this, right? We're going down, kind of feeling it through the quads, push up through the heels of your feet, and you really feel. That is really great exercise.
What do you think this one's important for?
Yeah.
So
Yes.
we see people doing this.
Yes.
They can't get up.
Right.
It's because those muscles are weakened.
Yep.
We also see when people go to sit down that they plop
Right.
because they have no control over those muscles.
It's all about it's about the deceleration of the muscles. And then the last one, kind of just reverse it. Bringing the knee up to your 90 degrees and slowly back down. Working those hip flexors in here. And again, it's just kind of working on a little bit of the strength, a little bit of the balance. You can use one hand, two hands. Just a basic kind of routine to get into, right? Routine to work through. That was all of those ones. The next ones, we're going to go back and we're going to go and sit in our chairs. So this is if you're not able to, your balance. If you want to just do some things where maybe your partner's not there, and you want to be able to, or you have a caregiver that's not comfortable guarding. But these are some great exercises to do, just kind of in the chair. So first one, we call it seated marching, right? Is easy, just kind of bringing and try to do slow, right? It's all about slow.
So where do you feel this? Oh, yeah. Your core.
Yeah.
So when we see that people can't roll to a side in bed, okay, or can't get in and out of bed, this is what's going to prevent that decline from happening as quickly.
Yeah.
These kind of exercises.
Next one is kind of what we did in standing, but we do it in sitting now. Heel to toe, right? This is really good, especially if you're sedentary and you feel like your legs are getting a little swollen. These are great exercises to keep that blood flowing. Sometimes our ankles and our lower calves get filled up with some fluid. These working the calf muscles, the natural pump to decrease any sort of swelling in the lower legs. So this is a great exercise, heel to toe. Keep those working. The long arc quad is just kind of kicking straight out. Again, nice and slow. Try to keep your posture straight. I saw that you slouched, right? As best you can, because you're working your core as well as your leg when you're doing that. If you're feeling you're sitting in your chair and you're feeling your back hurting, you need to work your posture a little bit better, right? You shouldn't be slouched. It's better to, yep, that's a good scoot. Doing those. Some of these other ones working the upper body, right? So this is just, and we have some bands that we can start with, but just work up nice and tall. We're thinking about good posture, squeezing the shoulder blades, and just bringing your arms up and then down, right? Because we don't do this a lot. just kind of doing. So we call this scaption because it's kind of at an angle, but it's just it's a natural plane that our arms go. So kind of bring it up. Again, good posture when we're doing this, right? It's not about slouching, right? It's just about nice, good posture. And
If you
down.
come too much out to the sides like this is not a normal way to lift your arms. Scaption is slightly forward. It's going to cause less chance of impingement up here. If you have somebody that has a shoulder impingement or a rotator cuff issue, which are common with people that are older or that have dementia, you're going to keep them just at a 90-degree
Yep.
range. You don't need to go all the way up here. You would just go to this 90-degree range.
Okay. And I love these other ones. This is always fun, right? Seated boxing, right? You just want to like get your aggression out in the air, right? And just do
So,
that.
is this your wife? So for this one, you want to turn and face each other.
Right. That's right. Right. Same idea. Just and really kind of like, force it. Like pretend like you really are like hitting that air. It's really good because you could actually work up a good exercise, a good sweat if you really go at it. So there's the jabs is the front. Then they have the hook, right? You're trying to give them the good old hook. You do that, and you could feel that if you do this at enough, again, up nice and tall, and then you can work into that upper, right? It's a great way to kind of and make it fun.
So the type of cueing you use, if you just say, box, do a boxing movement,
Yeah.
Mom, box, she might not register that. If you go, come on, Mom, punch it out, punch. You want to use cues that are more simplistic, that are more function-based than exercise-based.
Yeah, and you can stand in front of her, right, Mom? Hit my hands, come on, you got it. Really, and you can do that, and you can get a good workout, and have her, come up. So yeah, so that all that kind of stuff, the cueing is really good, and again, it gets your blood flowing, and it gives you a pretty good workout. These are just some other, like just getting those arms across and really think about bringing them back, right, and just kind of bringing them back. We don't do a lot of motion, a lot of things in this motion. Everything's like down here in the front. So we just want to kind of wake up the shoulders a little bit.
You pull your shoulders
Yeah.
back. You should feel a tightening come right in between
Yeah.
the shoulder blades. That's where people start to get extremely weak, and we see this posture start with the head forward. So this is what we see in older people. It's that the shoulders become rounded and then the neck goes up. So you want to get out of that posture by building those back muscles, that mid back right around your scapula.
Right. Even though this woman doesn't look happy, I don't know why, but shoulder circles, right? Kind of just, again, bringing the shoulders up and back. You really want to bring things back, right? And kind of think about squeezing that shoulder blade kind of up and back.
There's a machine called an arm bite that I often recommend for people for in-home use because they're not that expensive. You probably know them as feet cycling, but they also make them for your arms. And this kind of movement is very calming. And you can put somebody on this type of machine for 10 minutes. It's pretty mindless. They don't need to think about what they're doing. And it's great for people at this stage.
Right. And then one of our most favorite exercises as physical therapists and probably even OTs is to sit to stand, right? So this really works on the lower body, it works on the strength, the posture. So as much as you can, try not to use your arms. Put your hands on your thighs, and you're trying to slowly scoop and stand up, and then slowly sit and control yourselves down. We don't want plopping, okay? So trying to do this. If you have to use arms, you have to use them, you can. Whoop, yeah, right? So this is a great exercise for him to practice.
Which you're going to guard him on it.
Yeah, right, yeah.
So when you guard him,
Yeah.
It would be here and here.
Yeah.
So you sit down, sir.
Firm chairs. These are really difficult to do off low, soft couches, but really, and the real workout is the control sit. The control sit, right? You don't want to, you almost count in your head 1, 2, 3, 4 as you're sitting, right? That's a real workout. Oh, I look back. I was rooting for them all weekend. Since my JMU Dukes went down, we don't want to talk about that, MJ. But yeah, we had a faster seat the other night.
And just a quick tip that I think, seeing that, if a chair does not have arms, what can you do to make it safer to get out of? So if you've got somebody in a chair, there's no arms, they can turn to the side. They can use this part and this part and push up. So you may do the exercise like this in this kind of a chair. Okay?
Okay, so those are just some basic standing exercise and basic sitting exercise. I have copies here we can hand out, and people on Zoom we can PDF them out. Yep, we can email those out for sure with more directions and all that. But like I said, just basic getting into the routine so that this can be part of their. Yep.
Is it more beneficial to be towards the front of the chair rather than
sitting
leaning
back.
Yeah.
on the back?
It's more beneficial the less you can use your arms. So, I mean, if you're sitting back here, the problem is that people that are in this stage or with dementia or just that are older in general don't forward flex before they stand up. So what they do is they try to stand up with their body upright, and it's almost impossible.
You sit all the way back in your chair there.
And try.
Try to stand up.
It's not going to be, you're going to feel like a pregnant woman.
Yeah, like you have to have that ability to really scoot yourself forward.
So you should, so if you're working with somebody who has trouble getting out of the chair, you can cue them to scooch forward and then come up. But also, the biggest thing we see is people don't bring their head down. So we use the term nose over toes, mom, and then push up. As soon as their head comes forward, their tush already starts to come up without them having to activate too much muscle.
Sometimes I get dizzy just from standing up. What causes that?
It could be a couple of things. Usually, it could be dehydration. It's a change in your blood pressure because as we stand up, the blood pressure changes.
It's usually
definitely water drinking during any of this exercise is really important.
Yeah, if you're sitting for a long time, doing those ankle pump things will kind of help that blood pressure from, what happens is the blood kind of like drops down, right? So that's why you keeping those that natural pumping mechanism in the calf will reduce that, or we call it orthostatic hypertension. Yeah. So really important to do that.
You know, if it's a regular ongoing issue, do bring it up with your doctor.
Yes.
And they might recommend that you take the blood pressures after you stand up from sitting for a while and see if it drops.
Yeah, they'll monitor you.
Walking up the stairs sometimes causes.
Like shortness of breath or dizziness?
No, the dizziness.
Yeah, I would definitely mention, I mean, it could be nothing, it could be what we're talking about, but it could be, there are people that have AFib that have some of those symptoms early on, so you want to make sure that it's nothing more than what we're mentioning here. But dehydration is huge. So with somebody with dementia, you have to remind them constantly to drink, because that's one of the highest reasons for hospitalizations, is they just stop drinking.
And then they develop UTIs. So
Urinary tract
yeah,
infections.
urinary tract infections. Okay, you want to talk stage 3?
So stage 3 and 4, but you're starting to get more severe, and the road exercises are maybe not as appropriate. So you're seeing a reduced affect. That means that you're going to look at your loved one and think there's no joy. Some of it is just the face, okay? So we call it a flat affect, and it's common in Parkinson's, and it's common in dementia. Does not mean that that's a reflection of how the person is feeling, okay? Sleep disturbances, so people's cycles are off, they're up at night, and they're sleeping during the day, all the better to get them exercising and moving during the day so that their sleep is better at night. So people will say, well, what do my mom wants to take a nap. A nap, 30 minutes, 30 to 45 minutes, no longer. Because if they sleep longer than that, that's going to affect their cycle. They don't have a chance to go into deep sleep at that time limit. So it's more of a rest that rejuvenates them, and they should get up and be able to get back to regular function. If you let somebody go into a deep sleep, they're going to be sleepy the rest of the day, and then at night more likely to be up. You might see some agitation, paranoia, again, some of the things from the other stages, and activity is awesome for this. If you leave somebody idle, they will become agitated. I would become agitated if I was told to sit idle doing nothing and just staring at a TV or at nothing, right?
Back to naps, you had mentioned 35 to 40 minutes. And I'd always thought naps were good for you, but now I'm hearing just do 0 naps. If you're worried about Alzheimer's.
If you're worried about Alzheimer's,
Yeah,
not to nap at all.
yeah.
So we're talking about more people in these like later stages of dementia that need to nap. So in the early stages, if they're talking about if you're worried about developing it, yes, you should, a healthy individual should really be up during the day and then sleeping at night. But once you start to have these kind of conditions, you're going to need to nap.
But a nap is a nap, not
Right.
4 or 5 hours. I mean, it's
Dozing
really
off.
more than like an hour, then it starts to really be detrimental. Then you start to get out of your rhythms, your natural rhythms.
Apraxia and agnosia is evidence. So this is where people forget, like they might pick up a spoon and forget what a spoon is used for. They're going to not recognize items the same way that they used to. So this is where you want to start locking certain things up, because people may put it in their mouth and it might not be appropriate to be in their mouth. And this might be a time where you have to do hand over hand assistance to remind people what something is, like a spoon. The concentration is decreased. The visual and functional spatial, so we talked about the visual issues, they get worse in this stage. And the things, the household tasks are definitely not able to be done by this person. So by this point, there's absolutely no driving. There's no bill pay on their own. There's no maintaining household type tasks. You cannot rely on this person, and they could be unsafe. They definitely should not be living alone. The beginnings of some incontinence sometimes take place at this point, so you might have to think about, hey, maybe it would be helpful if we leave a urinal bedside for dad, because maybe he's going to go more frequently and have more issues with incontinence if he can't get to the bathroom fast enough, or maybe it's just not safe for him to walk to the bathroom anymore. So you're going to start thinking about things like Depends or briefs or pads, because one thing you want to do is you want to keep somebody confident about leaving the house. So if that person is worried about incontinence, they're less likely to go out into the world. You don't want that to happen. So people fight wearing a brief or a Depends, but a lot of times it could give people freedom, okay? Assistance for toileting and hygiene at this stage for sure, and this is really important. You want to make sure that somebody is completely cleaned up every time they have a bowel movement or they urinate. If somebody's wearing a brief and they cannot make their needs known, it should be checked every 2 hours. Most people should be urinating every 4 hours. If they're not, they're dehydrated. Okay. So at this stage, you know, what do you do with people? How do you keep people active? This is where you're downgrading, but you're using things from their past, because what do people with dementia still remember? Stuff about their past, right? So if somebody was a mailman, a great activity, let's say you're cooking and you're worried about your dad because dad usually tries to get up and wander off when you're not 100% focused on him. Well, you might give him a mail sorting activity. Literally give him a bunch of envelopes and have him sort, or think he's sorting. Those things are going to be familiar, and they're going to give somebody or have somebody remember when they were working. And for most people, thinking back on when they're working makes them feel proud and productive. So you want to reproduce that feeling. You want to simplify the environment. You want to structure the settings or activities. At this stage, doing more at home might be appropriate, because groups, somebody might need too much assistance, or it might be too overwhelming for them. You want to maintain daily routines, and I love the use of whiteboards for people. So I always say, put the day, and you change the day every day on the whiteboard. Don't put the year, because to that person it's not 2024, it might be 1937. So just put the day to give a little orientation. Hey mom, today's Monday. Today we start the day by getting your hair and nails done. Remember, we do that on a Monday. And then before lunch, we do your strengthening exercises. And then we have lunch, and you have it kind of on a board, and you're the one kind of going through it with that person to show them that today there's a structure to the day. It gives people a peace of mind. You might have to start reviewing the names of things using pictures. And definitely by this point, you're standing by and guarding during walking and certainly during exercises. So this, you really want to be doing more seated exercises or activities instead of exercises. So if I have somebody hang clothes on a clothesline, for example, and I give them clothespins and I have them hanging on a line, this is exercise, right? If they're doing this, they're reaching. I might have them standing if I'm guarding them, right? So this might be an activity where you're incorporating balance, hand strength, arm use, shoulder range of motion. So all of those activities that you think are just, you know, household chores, some of those now are exercise for somebody with dementia that has an easier time and feels more fulfilled doing those kind of activities than rote exercises. So in the later stages, something that becomes a goal and really important for people as they're starting to lose strength is the ability to get in and out of bed, the ability to use their core muscles. So really easy exercise, and you don't have to guard somebody necessarily unless they have bad sit balance, but is to have somebody scoot. This is going to come in very handy in the future for that person, because when you get into bed, it's all about repositioning your body. This takes a lot of strength and energy to get yourself in a position to then swing their legs in and lie down, and to get up. It's core muscles, right? And then leg coordination and movement. So doing some, don't lift somebody's legs for them if they can do it themselves. Have them struggle a little bit because they need to hold on to their core strength till the very end, okay? Some other activities are like folding laundry and stance. That's a great activity for somebody. And you might feel like, well, aren't they going to be like, why am I folding laundry? A lot of times, no, especially if it's somebody that was a homemaker that found that a kind of a soothing activity that they did. You know, I find doing laundry actually very calming. Maybe I'm weird, but I find folding laundry and putting piles together, it's kind of mindless, but it kind of, the repetition of it is very soothing. And for people with dementia, repetition is very anxiety reducing. So that kind of an activity might be great for them. Making a bed is a great activity if somebody still has the balance to do so, because you have to walk around the bed, you have to tuck it. It's actually a pretty hard task to make a bed, right? And it involves muscles, it involves coordination. So that's another activity as an exercise.
And what's nice about it is that once it's made, they feel accomplished, right?
They feel like they participated in taking care of their house. So it's all about not letting somebody feel like their worth is diminished. Because again, right, somebody at all stages has a reason for being. And then these are the stages where you're starting to get to a place where exercise may be too taxing. And when you want to think about, you know, are there daily routines exercise? Is somebody just sitting upright in a shower? That might be enough for them. So you really have to be careful how much activity you're incorporating, but you still want to encourage as much as possible within reason. You'll see the signs of fatigue, and you'll know when to stop at somebody with this in this stage. They may be at a point where towards the end of this stage, that they cannot really partake in lifting their arms or doing those kind of exercises or activities. That might be where you have a therapist or show you or teach you exercises so that they don't lose range of motion. So Gigi, let's say, is my caretaker, and I sit like this all day long, so my arms are tight. So my caregiver might want to just stretch me out a bit, and I can't do it myself.
You know, because again, we always are so forward. So it's just about just gently trying to get anyone to relax and just trying to use the natural, as you bring it up above their head, using natural gravity to kind of bring things down.
So this is the exercise you're looking at in these later stages, just keeping somebody mobile, keeping the joints lubricated so that they're in a place of comfort. Okay?
Do you
Thank
guys,
you so much for coming.
you want copies of the exercises? Yeah, here.
And do you have a TheraBand?
Yes.
Thank you. We had an appointment at 12.
Yeah.
No
And
worries.
we are talking about that sit class, that, you know, these are the great classes for your husband. He's balancing you on.
Thank you so much for coming.
Okay, thank you.
Yeah. Okay. So we'll kind of move through. I know we're running So I think we kind of talked through
Went
most
through
of
this,
this
yeah.
stuff. Okay. You were going to talk a little bit
Yeah,
about
and I
the.
was gonna say, hands are so important, okay, as you're aging to keep strong. So what happens is these thenar eminences, this fatty part of your hand starts to, you'll see it start kind of deflating on people. You need that in order to grasp onto things, right? So as you get older and you become more reliant on caregivers, you need your grasp to do things like stand up at a bar, right? So that somebody can help you do a transfer onto a toilet, or hold a grab bar in a shower, or grab onto a rail to turn and position yourselves. So don't forget about your hands. And there are exercises that we can tell you about for your hands, but there's putty exercises where people just squeeze and pull on putty. They're picking up coins, like a coin retrieval, which is a coordination activity that I could give you probably a half hour of hand activities for people to do that that work wonderfully, because they often get ignored, and you need your hands for self-feeding. Oftentimes we see that go with late stages of dementia because people do not have the grasp or the grip to hold on to a utensil.
Okay. So how can we help, right? It's our little plug for RVNA Health. We have therapy programs in your home. We can come to your home. If you live in an assisted living, we can come to your assisted living. We can use if both your Medicare Part A benefit, Medicare Part B, depending on if there's a acuity to have therapy come to you. Or you could come to us. We've got the Rehabilitation and Wellness Center downstairs with PT and OT and speech. As well in the home, we have PT, OT, and speech that can work on the things that, OT works on what Danielle was talking about. If there's any of the hand, the ADLs and all that kind of stuff. We also have some group programs. We were talking about exercise. One of our really good classes that we have is called Balance and Beyond. This is a little bit more of a higher level class. It gets you walking. It gives you a great workout. If you need help, your caregiver can be there with you. We encourage people to get on and off the floor, but it really gets you up and going. These are paid classes, and then we're starting a new chair fit class on the 16th, which really is working to boost that cardiovascular, but from the chair, those things that we talked about. So there are some classes that we have here to help keep everyone going. And those are both all in this facility. The role of therapy, again, is education, fall reduction. We can do maintenance programs, kind of keep you where you are, behavior management, come up with compensatory strategies, work on your home. If we come to your home, give you ideas about how to get your home set up safe, help with feeding, positioning. We work with skin protection, durable medical equipment, different things that you may need or your loved one may need. We can give you recommendations for that. Wandering devices, that's a big topic these days. So
So if you wanted to keep somebody walking in the neighborhood, for example, and they were in the early stages, but as a caregiver you were worried about them getting lost or not returning, there are tracking devices that you can put on somebody. A watch is fine, but if it's somebody that doesn't want to be tracked and they take it off, you have a problem. And I have had that happen. So they make things now that are built into sneakers. It's a shoe tracker.
It's called Smart
And
Soles,
it's
actually.
awesome. So
It's
if you have
actually,
somebody
yeah.
that wanders,
Yeah.
you can find them and track them down instantly
It's
with
an
this tracker.
insole that you put into someone's shoe. They don't even know it's in there, and then it will. And there is so much out there. There's actually a website. I think it was called Alzheimer's Wander. If you Google Alzheimer's wandering devices, there's a whole website that comes up too.
But it's enabled people to
Yeah.
stay so much more active. I read about a hiker who her goal, she was in early, but she was definitely getting more and more forgetful. And she said one of her goals was to go on one last hike without anybody with her, just on her own hike. So she used a tracking device, she used Google's Maps, and she was able to complete the hike. And that's awesome. She wouldn't have been able to do that without that kind of technology.
So
it's out there.
There's a lot out there. There really, really is, which is helpful. Just a little about some of our upcoming events. I think next week we're having Monica, our dietitian, talk about the impact of nutrition on dementia. Really important. Then we're having audiologists come in talking about the link between hearing loss and dementia. We're going to be doing another really about communication, working with your loved one and how to communicate and getting that connection. That's going to be coming on May 8th. We're going to be doing a whole thing on home modification for creating a dementia-friendly home. And then we have our long-term advanced planning with that's going to be in June, and then a hospice and comfort kind of a discussion that's coming up on June 18th. So we have got a lot of things kind of brewing out there. And again, all these series we are able to bring to you because of great donations. And I know Union Savings Bank helped support a lot of these programs.
If you're feeling like, you know what, I don't know where to start, and somebody in your family has dementia that you're helping, and they don't qualify for Med A. So Medicare A covers if you have an acute episode, hospitalization, you break a leg, you have a heart attack, you get the Med A covers your therapy after. If you're homebound, it covers it in the home, so OT, PT, etc.
Or nursing, or
Yep.
other aid care. So that's more of an acuity. Med A, think like acute episode.
But let's say you've got, this kind of a chronic condition, and you as a caregiver would like some education, would like a home modification, or somebody to take a look that things are safe. You can use your Med B benefit, which is the same benefit that you'd use for outpatient, but Med B also comes into your home. Okay, so those are people that can come and screen your home, teach you some basic exercises to go through with your loved one, and just offer overall dementia education for you going forward.
Which is different than a managed Medicare plan, which is a whole nother conversation. These are straight Medicare A and straight Medicare B.
You need a doctor referral or a script to do the Med B in the home?
Not for the first visit. We can go into your home and do an evaluation. And then if we determine that there's a need and there's a skill and that we will need to do ongoing therapy, then we send that to that plan of care that we've come up with to your doctor. And if he signs off on it, then that's all we need to continue. For Med A is different because that's usually an acuity and there's been some sort of change in your condition that we absolutely need a doctor's order. But under Med B, we can do the first visit and get him sign off or her sign off.
And do Advantage plans?
So the Advantage plans are a little bit different. Advantage plans will only allow us to go into your home if there is an acute episode. It doesn't pay for that kind of chronic assessment, that kind of stuff. So yes, we can go in, but once there's been a change in your condition, then we could justify the need to come to you with the Advantage plan.
Any other questions?
Just on everything you do for so helpful.
It's very helpful.
Even, I mean, I'm a retired registered nurse, and this is helping me anyway because it's
Great.
It's a,
So that.
Yeah, and the philosophies have changed from,
Yeah.
years ago with working with people with dementia.
Even working in a hospital, working in a nursing home,
Yeah.
and I, exactly what you're talking about. This is good to put into your long-term memory,
Right.
so that you learn how to do it.
Yeah.
Yeah.
And we want you to leave thinking about moving.
Yeah.
So we're going to give you some balloons to play with each other for a second. You're going to stand up and leave here happy. Some great exercise for balance, endurance, coordination.
Yes, balloons are
awesome.
they're really good. So here is here are these.
Seated or standing. So we can incorporate a step forward with this. Step and hit. Get your foot under. Yes, exactly. Get your foot in. But it's really nice for, so he's doing what's called static standing. And you can also use it and say, take a step when you hit. So wonderful. And even just doing it seated.
It's a task.
Yeah.
Okay. All right, thank you,
Thank you so
everyone.
much for coming.
Thank you.